These new Medicare Part B costs for 2026 are going to impact every senior's budget in a big way. The Centers for Medicare and Medicaid Services just dropped some numbers that'll make your wallet feel lighter, and you need to know exactly what's coming your way. Here's what's happening to your monthly premium. That standard Medicare Part B payment jumps from $185 in 2025 straight up to $202.90 in 2026. We're talking about an extra $17.90 every month, which adds up to nearly $215 more per year. And that's just where this story starts getting expensive. Most seniors rely on Medicare Part B as their primary healthcare lifeline outside of hospital coverage. It handles your doctor visits, outpatient services, home healthcare, and medical equipment that Part A leaves behind. Part A covers your hospital stays and inpatient care, but Part B keeps you healthy day after day. When costs spike by nearly 10% in 1 year, that's going to sting. This year's percentage increase hits 9.67% for the standard premium. Compare that to the modest cost of living adjustments we've seen recently, and this jump stands out as a real budget buster. This isn't some minor adjustment you can ignore. Your annual deductible takes a hit too. It climbs from $257 in 2025 to $283 in 2026. That's another $26 you'll shell out before Medicare kicks in to cover your Part B services each year. The deductible increase actually outpaces the premium bump at 10.11%. Now here's where things get tricky, and this catches a lot of seniors off guard. That $202.90 standard premium only applies if your modified adjusted gross income stayed at $109,000 or less as an individual filer, or $218,000 or less filing jointly with your spouse. Earn more than that in 2024, and you'll pay substantially more through something called the income-related monthly adjustment amount. Let me break down what these income brackets mean for your actual monthly payments, because the higher income increases are even more dramatic. Single filers with 2024 income between $109,001 and $137,000, or married couples filing jointly between $218,001 and $274,000, face monthly premiums of $284.10. That's up $25.10 from 2025's $259, which means an extra $301.20 annually. The next bracket hits harder. Single filers earning between $137,001 and $171,000, or joint filers between $274,001 and $342,000, pay $405.80 monthly. That's $35.80 more than 2025's $370 rate, translating to $429.60 extra per year. Single filers between $171,001 and $205,000, or joint filers between $342,001 and $410,000, see monthly premiums reach $527.50. The increase from 2025's $480.90 means $46.60 more each month, or $559.20 annually. Higher earners face even steeper increases. Single filers with income between $205,001 and $499,999, or joint filers between $410,001 and $749,999, pay $649.20 monthly. That's $57.30 more than 2025's $591.90 rate, adding $687.60 to their annual costs. The highest earners get hit hardest. Single filers with $500,000 or more, or joint filers with $750,000 or more, face monthly premiums of $689.90. That's $77.20 above 2025's $612.70 rate, meaning an additional $926.40 per year. Married couples who file separate returns face a particularly harsh penalty structure. If your separate income stays below $109,000, you pay the standard $202.90 rate. But earn above $109,000 and below $391,000 on separate returns, and you jump directly to $649.20 monthly. That's the same rate much higher income joint filers pay. Separate filers with $391,000 or more pay the maximum $689.90 rate. This separate filing penalty exists to prevent high-income married couples from gaming the system, but it creates nasty surprises for people filing separately for legitimate reasons. Understanding Medicare's income timing is crucial for planning. They don't look at your current income when setting your premiums. Instead, they use your modified adjusted gross income from your tax return filed 2 years earlier. So your 2026 Medicare premiums reflect your 2024 tax return. This 2-year look-back creates both challenges and opportunities. Had a high income year in 2024 from selling investments or taking large retirement distributions? You'll pay those higher premiums in 2026, even if your current income drops significantly. Planning a high income year? You've got a 2-year buffer before it affects your Medicare costs. Certain life-changing events can trigger an appeal process. Marriage, divorce, death of a spouse, work stoppage, or reduced work hours might qualify you to request recalculation based on more recent income. This involves filing Form SSA 44 and providing documentation of both the life event and your reduced income. These premium increases reflect Medicare's funding structure. Part B premiums cover approximately 25% of the program's costs, with general tax revenues funding the remaining 75%. Higher income beneficiaries pay larger shares ranging from 35 to 85% of total Part B costs, which explains why those penalties are so substantial. This year's increase reflects several cost drivers hitting Medicare hard. Healthcare inflation outpaces general inflation, particularly for physician services and outpatient care that Part B covers. The Medicare population keeps growing as baby boomers age into the program, and they're living longer while requiring more complex medical care than previous generations. Part A costs are climbing too, though fewer people pay Part A premiums directly. The Part A deductible for hospital stays increases from $1,676 to $1,736. Daily coinsurance for extended hospital stays rises from $419 to $434 for days 61 through 90, while lifetime reserve days jump from $838 to $868 daily. Skilled nursing facility coinsurance for days 21 through 100 increases from $209.50 to $217 per day. Medicare premium payments work through automatic deduction if you're receiving Social Security benefits. Your Part B premium gets subtracted directly from your Social Security check, which means this increase will reduce your monthly payment. If you're not receiving Social Security yet, Medicare will bill you directly. This automatic deduction can strain cash flow for seniors on fixed incomes. When your Social Security check drops by $17.90 monthly, that requires real budget adjustments for many people. Late enrollment penalties make these costs even higher. If you didn't sign up for Part B when first eligible and lacked qualifying employer coverage, you face a permanent 10% penalty for each full 12-month period you delayed enrollment. This penalty gets added to whatever premium your income level requires. These Medicare costs will likely keep climbing in future years. Healthcare costs consistently outpace general inflation, and the Medicare population continues growing and aging. While we can't predict exact 2027 increases, the upward trend seems clear. Medicare supplement insurance and Medicare Advantage plans become more attractive as these costs rise. Medigap policies help cover costs that traditional Medicare doesn't pay, including deductibles, copays, and coinsurance. Medicare Advantage plans offer alternatives to traditional Medicare with different cost structures and often additional benefits. If you're in the Medicare annual open enrollment period through December 7th, these cost increases should influence your 2026 coverage decisions. You can switch between original Medicare and Medicare Advantage, change Medicare Advantage plans, or modify prescription drug coverage during this window. High-income beneficiaries facing substantial penalties should consider planning strategies with financial advisors or tax professionals. Roth conversions, charitable giving strategies, and careful timing of retirement account distributions can impact your modified adjusted gross income and potentially reduce future penalties. Municipal bonds appeal to high-income Medicare beneficiaries because their interest typically doesn't count toward modified adjusted gross income for penalty calculations. This can generate retirement income without triggering higher Medicare premiums, though you should evaluate overall returns and risks of any investment. If you're still working with employer health insurance, you might delay Part B enrollment without penalty as long as you maintain qualifying employer coverage. However, coordinate carefully with your employer's benefits administrator to understand how employer coverage works with Medicare and avoid coverage gaps. Social Security administers premium payments even though Medicare provides the coverage. Questions about your specific premium amount or appeals of penalty determinations go through Social Security at 1-800-772-1213, with TTY service at 1-800-325-0778. Social Security sends notices showing your exact 2026 Part B premium, typically arriving in late November or December. If you disagree with your penalty determination, you can appeal, but you'll need to act quickly with proper documentation. These Medicare cost increases reflect the broader challenge of healthcare affordability for seniors. While Medicare provides essential coverage, combining premiums, deductibles, and cost sharing can create significant financial burdens, especially on fixed incomes. Medicare costs often rank among seniors' largest budget categories after housing. When premiums jump nearly 10% in 1 year, it forces difficult decisions about other expenses. Understanding and planning for these costs becomes essential. The timing of these announcements during Medicare annual open enrollment gives beneficiaries chances to review coverage options and make changes based on new cost information. However, the short time frame between announcements and enrollment deadlines makes thorough evaluation challenging. Several assistance programs help seniors struggling with Medicare costs. Medicare savings programs through state Medicaid offices can help pay premiums, deductibles, and copayments for people with limited income and resources. The Extra Help program assists with prescription drug costs, and some states offer additional programs for Medicare costs. These programs target people with truly limited financial resources through income and asset limits much lower than penalty thresholds. For those who qualify, they provide meaningful relief from Medicare costs. Everyone with Medicare Part B pays more in 2026. How much more depends primarily on your 2024 income. Standard premium payers face about $215 more annually, while higher income brackets could pay several hundred or nearly $1,000 extra per year. Understanding exactly what you'll pay and factoring that into your 2026 financial planning is your best move right now. If you're still in open enrollment, consider whether these cost increases change your thinking about Medicare Advantage or supplement insurance. If you're facing income-related penalties, explore legitimate strategies to manage future income and potentially reduce those penalties. These increases are substantial, but they also remind us of Medicare's value. Part B covers essential outpatient medical services that keep you healthy and out of the hospital. While nobody enjoys paying more, having access to quality healthcare in retirement is worth protecting, even as costs continue rising. The 9.67% Medicare Part B premium increase for 2026 is significant, reflecting rising medical care costs across the entire healthcare system. Understanding these costs and planning for them is part of managing retirement finances. Stay informed, understand what you'll pay, and take advantage of opportunities to optimize your coverage and costs.